view the program at a later time. So when it appears on your screen, please click Got It. If you're not familiar, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age. AARP works to strengthen communities and advocates for what matters most, with a focus on health security, financial resilience, and social connection. Today's program focuses on financial security. So if you haven't already, please put your first name and what city you are zooming in from. Who's us today, Joyce? Who do you see in the chat? We got a lot of people with us today.
Yes, we do have a lot of people. We have a lot of people from Los Angeles, Cerritos. We even have coming in from Lawrenceville, New Jersey, San Francisco, Fountain Valley, Tracy, California. And then we have some coming in from, what is this? Oh, Indianapolis. Can you believe that? Indianapolis, Washington State, Tallahassee, Florida. Oh my goodness, they're coming in from everywhere. Norfolk, West Virginia. Well, take it away. This is Michigan. I can go on and on and on and on. Go ahead, take it away.
Thank you so much, everyone, for joining us. Thank you, Joyce. We appreciate that. To get warmed up today, we have 2 poll questions. We'd ask you to quickly submit your answers. Question number 1, does Medicare cover long-term care? Oh, wow, we seem to be pretty well informed about that. 5% say yes. 83% say no, and 13% say unsure. Okay. And poll question number 2. Is there a difference between a skilled nursing facility called an SNF and a long-term care facility? And we're going to take that poll. Oh, wow. Okay. Good. Well, we have a really informed audience today. 80% say yes, 9% say no, and 11% say unsure. We're going to get those answers today, that's for sure. Thank you, everyone, for participating in the poll. Today we're back with Martin Booker. Today is a special Piggy Bank Essentials with Martin. Each quarter this year, we have focused on different aspects of money management. Today, we're excited to bring you Understanding Long-Term Care and Financial Planning. And we do want to share our disclaimer. This session is intended to be informational and educational and does not constitute financial advice. Please consult your financial or tax advisor or lawyer for advice regarding your personal situation. AARP is not responsible for the consequences of any decisions or actions taken in reliance upon or as a result of the information provided during this event. And it is now my pleasure to introduce our guest speaker, Martin Booker and Vanessa Souza. Martin is a program manager at AARP, leading various financial education initiatives about investing, Social Security, and budgeting. Martin has a master's degree in social work from the University of Connecticut and is a certified financial planner. Prior to coming to AARP, he worked in the nonprofit sector in Washington, D.C., and developed a passion for helping people improve their money habits. Today, Martin offers individual and group coaching services and classes and leads workshops about credit, investing, retirement planning, and other finance-related topics. His goal is to engage and educate people to better understand how to make money and keep their money. Vanessa Souza is a licensed clinical social worker with a focus on supporting older adults. She has a particular interest in ensuring people living with Alzheimer's disease and dementia that their family and friends have the knowledge needed to prepare for the future. She has worked as an assistant living administrator, memory care director, and as a social worker in adult daycare. Today, she works as the senior manager for community engagement at the Alzheimer's Association of Northern California and Northern Nevada. So remember, please put any questions for Martin and Vanessa in the chat during the program, and they will answer as many of them as they can during the Q&A portion of our program. Welcome, Martin and Vanessa.
Thank you. Thank you. Thanks for that warm welcome, Jacqueline. We really appreciate it.
Yeah, thanks so much. Happy to be here.
All right, so let's take it away. Let's get this conversation started. We're so glad to be here. We see lots of questions coming in the chat. Lots of warm welcome in the chat from everyone. So we're so glad to be here and so glad to have this conversation. This is such an important conversation, and so much good information that we're gonna share with you all today. So we don't want to waste too much time. So just as we have this conversation, I want to, we had a couple of good poll questions that came through. Those are some really good poll questions, and I want to make sure that we get you the answers to those. So we're going to talk about those throughout this presentation today. We're also going to talk about some additional information just to make sure that you know a lot of know some of the differences between between Medicare and Medicaid. We're going to talk about what there is to know about funding and understanding these services, about long-term care, because that's going to be an important conversation to have, just to make sure that you truly understand what's covered, what's not covered. We know that it can be complicated. So, and I'm so glad that we have Vanessa here today to help us with some of these complicated and complex topics. All right, and we're going to show you some slides in a second, but before we dive into that, let's answer one of those questions. So Vanessa, just from you, one of the things that we did talk about long-term care. So to start with Medicare, does Medicare actually cover long-term care?
No, and I think that's really surprising for a lot of people. So Medicare, ARE, just to be clear, does not cover long-term care, meaning Medicare does not pay for your stay or your loved one's stay in an assisted living, in a memory care facility, or long-term in a skilled nursing facility.
Okay. And so what about Medicaid?
Right. So Medicaid is run between federal and state programs together, right? And in California, where I am, our Medicaid program is called Medi-Cal. So if you have Medi-Cal, that's Medicaid. Or in other states, it may go by different names. Like in Washington, it's called Apple Care or Apple Health. But your state Medicaid program does provide some long-term care coverage. So it can help with things like a permanent or long-term stay in a skilled nursing facility. And it can also help pay for care in your home. So help pay for someone to come to your house and take care of you. What Medicaid typically doesn't cover is those assisted living facilities. So when we talk about the different types of long-term care, we can dig into that a little bit more. But the short answer is yes, Medicaid, AID, does cover some types of long-term care.
Okay. And while we're talking about that, could you tell a little bit more about like the differences between Medicare and Medicaid?
Yeah, so Medicare it's a federal program, it's a federal insurance program, and it covers medical expenses for Americans over age 65, right? So most folks over 65 will be Medicare qualified, Medicare beneficiaries. And it also covers younger people if they have a disability, so they may qualify earlier. Medicare is not based on your income, it's not based on your assets. Your previous conditions don't apply, you know, as you're covered or not covered. The only thing you need to qualify is to be over age 65 or to have a qualifying disability. So that's Medicare.
Okay. Okay. Thanks for the for breaking down those differences. I know it's important and it gets very confusing and trying to remember which is which within that case. All right. So tell if you don't mind. So when it comes to long-term care in general, so when we're talking about long-term care, which as you mentioned is covered by Medicaid, right? That one's covered by Medicaid. What are some of the different types of long-term care and what services do they provide?
Yeah, that's a great question. I think if you're able to share the sort of big Venn diagram, the color slide, that'll
Yep.
might help for folks to take a look at it and see what it looks like.
All
Because
right.
it can be complicated.
Yep. Yep.
Um,
Okay.
yeah, long-term care is not just one thing, right? It's a whole ecosystem of different things. And so on this slide that Martin has here, the senior living spectrum, you should be able to see that. These are just some examples of the different types of care that make up long-term care. Long-term care is really just anything that takes care of you as an older person for the rest of your life, right? In the long term. And it goes along a spectrum of low care, low amounts of help, and low amounts of supervision to very high amounts of help and high amounts of supervision. And the cost varies as well. And what's more confusing, I think, is that the cost and the amount of care don't increase kind of one to one. And not all of them are paid for by the same things, and you don't qualify for all of them in the same way. So again, the very low end, least amount of help and sort of least amount of supervision would just be living in a senior apartment, right? A lot of us probably live near or maybe live in these 55 plus apartment communities. The rent is usually subsidized, so it's a little bit less expensive than living in a typical apartment. There might be some community activities that are going on. There might be an option to gather with other folks for meals and things like that. But for the most part, it's just an apartment building and there's no services, no help. A retirement community, especially a continuing care community, something like that. Those tend to be these larger places created just for seniors that include some emergency services. So you get your apartment or your condo, you get some activities, and there might be, say, emergency services or emergency maintenance services if you need help in your house. There might be an option to have all your meals at a communal dining place, things like that. And then further along would be something like an assisted living, where you're living, you're getting your apartment, and you're also getting some physical help. So in an assisted living, people are going to help you with what we call activities of daily life. That would be like bathing, dressing, grooming, meals. They might remind you to take your medicine. They might order your medicine for you. But assisted living is a non-medical environment, technically. And so while there might be a nurse who's going to kind of check on you, they can't do any skilled nursing services. Meaning if you have really heavy medical needs, assisted living can't help you with that. And assisted living is much more expensive than just a senior apartment or retirement community. And dementia care or a memory care facility is actually most of the time in most states licensed as the exact same thing as a regular assisted living. So they do really specialized care, but as far as the government is concerned, as far as the state is concerned, it's just a different type of assisted living. And that, so then again, they will not do that heavy medical care there. And then finally, a nursing home, skilled nursing facility, some people might refer to it as a SNF, is 24-hour supervision by medical professionals. So there's always nurses there. They can do that heavy type of care. Like, so for example, if you have a feeding tube, if you have a catheter, if you have IV treatments that you need, all those kinds of treatments you can have in a nursing home. And nursing homes are one of the long-term care options that Medicaid will pay for long-term. And, you know, again, if you're paying for it privately, a nursing home would be, again, more expensive than an assisted living because you're paying for kind of a more intensive amount of care. I did see someone pop in the chat, where does palliative care fall in here? And hospice care and palliative care can actually happen in any of these places. So we can, I don't know, Martin, if you wanted to hold and talk about that in a minute, but
You can roll right into it if you like. Do you want
we
to?
can go right into it. So hospice and palliative care can happen literally anywhere. So here's my not very sophisticated Venn diagram. But so when we think about long-term care is for anyone who is aging. Palliative care is for anyone who is at any age living with a chronic illness that is not curable, that is terminal in the long term. So even someone, even a child, even a younger adult can be on palliative care. Palliative care just means that you are seeking comfort, relief of symptoms and pain, and focusing on your quality of life rather than trying to stop or reverse a disease. So, for example, if you have stage 4 cancer that cannot be cured, but can be made more comfortable, you know, you can have symptom relief. That is something that someone might enter into palliative care for. Some other sort of long-term chronic illness that is not ever going to go away, but might require you to go to the hospital a lot, things like that. That's when we would bring in palliative care. It means you end up with a care team for emotional, physical, spiritual support. So you usually have, you know, a main doctor, but you also have nurses, home health aides, a social worker, a chaplain, folks like that to help coordinate all that care. And palliative care can happen at any point in having a chronic illness. So if you have a chronic and eventually terminal illness, you could live for 10 years or more under palliative care. You can still seek treatment and things like that. Hospice care. Another thing about palliative care is that it is either self-pay or through your private insurance. So those are the two ways to pay for palliative care. Hospice care is actually a highly specialized type of palliative care. And hospice care is for folks whose terminal condition has a prognosis of 6 months or less. So at the time you enter into hospice care, your doctor certifies that if your disease keeps going the way it is, you will pass away within the next 6 months. It is paid for by Medicare. It is paid for by Medicaid or insurance. So if you're over 65 or disabled and on Medicare, hospice is paid for by Medicare. You have no out-of-pocket cost for that. Another difference between palliative care and hospice is that you cannot take any curative treatment. So if you're in an experimental treatment or if you're receiving chemotherapy, things like that, you would have to stop that to go on hospice. You could stay on it under palliative care. Hospice happens wherever your home is. So if you live in a senior apartment, if you live in an assisted living, if you live in your private home, hospice follows you to where you live. And usually you get very frequent visits, like at least once a week, sometimes several times a week.
Thanks for that breakdown. I mean, it's so much information.
A lot of information, a lot to take in.
Yeah, and plenty of questions coming in the chat, which we'll start to get to after a while. But we do so. One quick thing, when it comes to Medicare, how do I qualify? And just quickly, while you're on palliative care, does Medicare cover it?
So usually for palliative care, yeah, your insurance will cover it, but um, it depends on whether you are seeking it through like different medical um, sorry, different medical programs set up their palliative care in different ways. So it would depend on the program. There's not a central way that palliative care is administered. But most of the time, yeah, your insurance will cover it, or they will have some sort of self-pay scale for charging for it.
Okay. Okay. Um, and with when it comes to qualifying for Medicare and Medicaid, what would I need, or what are the qualifications? What do I have to do?
So to qualify for Medicare, the only thing that you need to qualify for Medicare is to be over age 65 or have a qualifying disability. There's no income requirements for Medicare. There's nothing that is going to prevent you financially from having Medicare as long as you qualify by age or disability. Medicaid is a little bit more complicated because Medicaid has specific eligibility standards for each state. Every state runs their qualifications their own way. So California is going to be different from New York, from Washington, but you should be able to contact your state health insurance office and get that information that you need. Typically, there are income requirements for Medicaid. So there's a federal general requirement, and then every state sets their own income requirements. And then there's also asset requirements. So, for example, in California, there are certain asset limits. You have to have below a certain threshold of savings, property, investments, things like that. And that again varies by state.
Okay, perfect, perfect, good. Thanks for clarifying that and letting us know. All right, so now let's talk about, I mean, these programs when it comes to paying for long-term care. Like besides using my own savings, and what can I possibly do?
Yeah. So besides your own savings, I've seen some people talking in the chat about long-term care insurance. So yes, if you have a long-term care insurance policy, that will cover whatever the policy says it covers. They vary widely. And then the other options to look into would be things like grants from local organizations. So for example, in Northern California, the Alzheimer's Association has a respite care grant that can help people pay for a certain amount of care. HFC, which is an Alzheimer's charity, also has a grant. You might look into your veterans benefits if you or the person you care for or your spouse was a veteran. So there are several different programs through the VA, one of them being a program called Aid and Attendance.
Okay.
And Aid and Attendance is a program specifically to help folks who are homebound with paying for care.
Okay, good to know. And just, when we're talking about paying for it, how much does long-term care cost?
Yeah, long-term care is expensive and the cost can vary widely, right? So I did make a couple of slides. If you want to go to slide 5
Mhm.
in the deck to kind of show an example.
Okay.
So basically, the average rate of care in my area right now, which is San Jose, is around $34 an hour for in-home care. An assisted living facility ranges from $6,000 to $12,000 a month. And a skilled nursing facility can be between, $10,000 and $15,000 a month. Now, most people that are living long-term in a skilled nursing facility are having that, or at least some of that, paid for by Medicaid. So most people are not paying that $15,000 out of pocket. But that assisted living facility, that $6,000 to $12,000 a month would be private pay, out of your pocket, out of your long-term care insurance, out of other benefits. So it is really expensive. If you take a look at this graph that's here, this is showing median cost based on 10 hours of help a week. And so something I really encourage people to look at is how to do the math and see at what point in-home care becomes more expensive than another option. Because if you take a look at this, if you only need 10 hours of help a month, in-home care makes the most sense, right? That's the most financially efficient. You can, if you qualify for Medicaid, Medicaid will pay some of those hours, so you will get some of that paid for. Probably not everything you need. You'll probably have to supplement at some point, but you can get some help.
All right, give us 1 second. It looks like we may have had a quick technical difficulty with Vanessa. That sound about right, Vince? I think we may. Oh, okay. 1 second. She's on her way back in. She was in the middle of an answer, so we want to make sure that we hear the rest of that. So everyone just bear with us for a quick second. We know how technology works, right? Technology works until it doesn't. So just give us 1 quick second. She'll be back with us in a second. Just gonna make her a host and get her back in the limelight.
Sorry about that. The computer just booted me out.
No worries.
But anyway, yeah, you can see that at a certain point, this is 10 hours a week. It makes more sense to stay home because $1,000 is a lot less than 6,000. But also it is not all or nothing. So something like an adult daycare, which you can see on here, adult daycare is a part-time program. Folks go to a center 3 or 4 hours a day. And that is something that in many places is paid for by Medicaid or has a private pay option. And most of the time, these places have a sliding scale. So it can be a really good economical option to have some in-home care, maybe a few hours in home, and then supplement that with an adult daycare, which might be paid for entirely by Medicaid, or you might be able to pay, $30 or $40 a visit. So again, much more economical than moving entirely into assisted living. And then the next slide on here should show a little bit of a different example of if you need a little more time, right? So at 40 hours a week, you can see here in-home care and residential care, assisted living are starting to kind of even out, right? And so at the point that someone needs help more than 8 to 10 hours a day, that's when you're probably going to be looking at other solutions like a residential solution because staying home becomes more expensive than leaving. Now these graphs here, these are from the Genworth Financial Long-Term Care Calculator. So you can go to that website. There's also a calculator on AARP that you can go to and look for kind of the cost of care by zip code. And it varies widely across the country, of course, right? Just like any kind of service varies widely, just like any kind of rent varies widely. So again, you're looking at these examples. These are from where I am in the San Francisco Bay Area. Our prices are higher than other parts of the country, significantly higher, including other parts of California. So if you're in California or you're in another state, these costs may not be your costs. But across the board, long-term care is expensive.
Vanessa, one more time, where can that calculator be found?
Yeah, this is from Genworth Financial. It's just called the Genworth Cost of Care Calculator.
Okay. So helpful for people who want to just kind of plan or think it through in advance. They can kind of run some of these numbers just to get a general sense of where they'll be.
Yes, just to get a general sense of it. And it also can be helpful, if you're considering relocating to be closer to family, you can run, this is all based on zip code. So you can run different areas and make a comparison.
Perfect. And we did drop that calculator in the chat for everyone. So feel free to take a look when you get a second. Yeah, thanks for that information, Vanessa. That's amazing. And I saw someone mention, hey, now they're scared. Hey, it's good to know now and plan for it and prepare. So, we get to have these conversations, but, don't forget what Vanessa talked about right before this part, which is what are some of the ways to pay for this stuff, right? So thanks for sharing that information too, Vanessa. And this conversation will be placed on YouTube, so you can go back and rewatch it, share it with all your friends that's going to need this information, because that's going to be very important. All right, so Vanessa, when we think about how to find care, when we need some of this care, who can help us find some of this care?
Yeah. Well, there's a lot of places to go to look for care. One place to start would just be your immediate community. A lot of folks, what we know is that um, the majority of care, over half of the care given to folks with disabilities, and especially folks with Alzheimer's disease, is actually unpaid care. Most people are getting most of their help without paying for it, right? From friends, from family, from neighbors. So reach out to your immediate circle and your kin and see who can help, who has time, who has a hand, who knows somebody who might be a professional caregiver that is willing to come into your home. So reach out to your immediate network, because most people are caregivers at some point in their life. And all of us will need care at some point in our life, right? And so start with that. Start with your immediate personal connections. And then reach out to other resources. So, for example, at the Alzheimer's Association, if you're caring for someone with Alzheimer's or another kind of dementia, we have our 24/7 helpline that you can call to ask about care options near you, to have a care consultation and talk about that. Here in California, in the Bay Area, especially Family Caregiver Alliance is an option to call and get a consultation. And there's probably a caregiver resource center like Family Caregiver Alliance near you, wherever you are in the nation. There's also the Elder Care Locator, which is a great website where you can hop on and search for care near you. And again, that is zip code based, as is our Alzheimer's Association database. So you can look where you are, you can look where your loved one is that needs care if they're somewhere else, and go through it in that way.
That's awesome. And just to mention one more resource, aarp.org/caregiving, for lots of great resources as well on caregiving, how to caregive, more resources and information on caregiving. So, and then all modalities. If you prefer to watch a video, you can do that. But we also have workbooks, and we have articles and tools as well. So take advantage of all of these fantastic resources that we're sharing. Thanks for that, Vanessa.
Yeah.
Oh, go ahead. Did you want to share something else?
Oh, I was just going to say the AARP website and these other resources. Yeah, they're not just places to go to find a caregiver or find an assisted living. They're places to get education so that you and your loved ones can be better caregivers yourselves, right? Because again, a lot of us are doing ourselves. It's not always about what you can pay for. A lot of the times it's about what you can do and what your support network can do for you. So yes, absolutely.
And I was always told that there's only two people in the world: those that are caregivers and those that are going to become caregivers, right? So, because at some point we all have to we end up caring for somebody. And most of these resources are free of charge. So please take advantage of them. All right. And I know we have lots of questions. I know, Jacqueline, I know you're watching that chat. Just flow through with questions. So I'm gonna just ask you one more question, Vanessa, and then we'll dive into questions. So just one more for you, Vanessa. Is it more expensive to care for someone who has dementia versus someone who has a different chronic illness or disability?
Yes. So unfortunately, it is more expensive to care for someone who has Alzheimer's disease or another kind of dementia. There are unique needs for folks with dementia. They tend to have higher care needs, need more help for a longer period of time, and need special surroundings, right? So because some people with Alzheimer's or dementia might wander or get lost, they need more security, more supervision. And as you saw in that initial graph that we shared, the cost does go up more so with supervision than with anything else, because you need eyes and ears to keep that person safe.
That makes sense. That makes a lot of sense. All right, well, let's take some questions from the chat. And I want to make sure, just a quick announcement, because I'm noticing some questions going to my direct messages. I won't be asking all the questions. So please make sure that you click the drop down that says that the question is for everyone in the meeting, and submit your question that way, so that we make sure that we answer the questions as they're coming in. Jacqueline, am I turning it to you for Q&A?
Absolutely. Ooh, thanks so much, both of you, Martin and Vanessa. The information was really detailed, and I really appreciated the information. I learned a lot today. So let's go over to the chat and see what questions we have. Joyce?
Well, we have a lot of questions in this chat, and I am so happy that you'll be able to view this again, because this information is very important for members, and hopefully the way that you both explained it made a lot of sense, but you always need that extra boost to make sure you understand. So I'm going to go back to the very first question. One of the ladies is saying, my understanding is that Medicare starts covering when you turn 65. So she turned 65 in January and received her Medicare card, that red, white, and blue card. So her question is, would you clarify your statement about when does Medicare actually start? And about how long will it take for it to be approved?
Yeah. So if you qualify by being 65, that's how you qualify. The difference would be for folks that are qualifying for a disability. So for example, younger onset Alzheimer's disease is a condition that qualifies you for earlier Medicare. There is a list on the Medicare website of what those qualifying conditions are. I don't know myself the exhaustive list. It's quite a long list. And so if you are applying that way, if you're applying through disability, typically the way that it works is that when you file for Social Security disability, there's a 2-year waiting period between when you are granted disability and when you start getting those Medicare benefits. But take a look on the Medicare website. There is a section all about disability qualification. And in particular, you want to look for the section on the website about compassionate allowance. So compassionate allowance is the specific program that you want to look into, and it has all the forms and exactly how to work through the process.
Oh, great. Thank you so very much. I know that was helpful to many others. There's another question that says, is it correct that people have to pay back to what Medicare or Medicaid has spent on an individual on their savings or their properties?
So Medicaid policies vary based on your state. In some states, there is what's called asset recovery, which means basically if after the person's passing, Medicaid may come back and try to recover some of what they spent out of that person's estate, out of their remaining assets. But all of the Medicaid regulations are state specific. So you would need to check with your state office to make sure that you're getting the right information.
Okay, great. Thank you so much. There's a couple of questions about palliative care. So does Medicare cover palliative care?
Yes, in most cases, Medicare should cover palliative care. It's covered by insurance in most cases, but sometimes there are private pay programs. So it's a little bit different than hospice. Hospice is always going to be covered by Medicare. There is a specific Medicare benefit that is hospice care. Palliative care varies. So there's some programs that might be run that are entirely private pay. There might be programs that are that you can access through insurance. It depends.
Okay, because that was another question that's connected to that one is can dementia patients qualify for palliative care? So again, it depends. Is that a state situation?
No, so that typically, yes. It depends on what the other conditions are and what is going on with them. So for example, someone who has Alzheimer's disease, specifically to qualify for hospice, there are diagnostic criteria for hospice that person needs to meet. And there'll be diagnostic criteria for any condition. You know, in my time working in assisted living, when I was an executive director, sometimes we would have people who had Alzheimer's disease, but also had other chronic conditions, right? Most people who have Alzheimer's disease have other chronic conditions. And so they might be on hospice, not necessarily because of their Alzheimer's disease, but because of heart failure or some other condition. Does that make
Okay.
sense? I hope that answers the
Yeah,
person's question.
I think it does. It does. Now, thank you again for submitting some of these extra little assets that you put in here. So this person is asking, where does memory care fit into the cost graph? Because I remember you talked about the cost graph.
So that's a really good question. So again, in most states, memory care is considered the exact same thing as far as licensing, as far as regulations, as an assisted living. And most of the time, memory care is a section of a larger assisted living building, right? Sometimes there's memory care only buildings, but most of the time you're talking about a big assisted living building, and a section of that is set aside for folks with memory care needs, folks with dementia. Typically, it is a little bit more expensive there than in the assisted living. And where that comes in is that most assisted living pricing structure is a base rent plus the cost of care. And
Okay.
when it comes to the memory care, typically you're being charged more because you're being charged for more care.
Okay.
Does that make sense?
Yeah, that definitely makes sense. Thank you. Thank you for
Yeah.
clearing that up. Now, this is a true or false statement, and I think you mentioned it earlier, but it's somebody said, seems like more is paid by Medicaid than Medicare. Is that true?
For long-term care, it is true. So in terms of paying for caregiving, Medicaid pays for it and Medicare does not pay for it. So yes.
Oh, so that would be a true statement. Okay. So the other question, now there's a lot of long-term care insurance questions in here. So one of them is like, does long-term insurance cover dementia care? Because there's a lot of dementia questions in here also.
Yeah, so
So,
every policy is different in terms of what it pays for, but typically it's not about about the condition the person has. Typically, long-term care insurance coverage is about how much help the person needs and in what context. So typically, again, every single policy is different. They've even changed over the years the way that they're written. But in long-term care insurance, usually in order to start accessing your benefits, in order to start getting the money, you have to submit to that insurance policy proof, right? Documentation that you or the covered person needs help with 2 or more activities of daily living. That's usually the threshold to start using your benefits. And again, typically long-term care insurance comes through reimbursement. So they're not going to pay, in most cases, they're not going to pay directly. You're going to pay and they're going to reimburse you later. And
okay.
there's often a waiting period. So, you'll pay for X amount of time and then they'll start paying you.
Okay, great. Thank you. That clears that up. Here's another true or false statement. So is it true if you decide to move out of the United States, Medicare will not pay for any medical coverage? They'll drop you until you come back into the United States. Is that a true statement?
I don't know for sure about that. I'm not sure what the international coverage is for Medicare. I would recommend calling them to ask that question directly.
Okay. Now, is there a part of Medicare that will pay some or more of the long-time care? Like, I think you mentioned something about Part C and D. Can you adjust that again, please?
Sure. So Medicare does not pay for any long-term residential care. What Medicare will pay for is like if you have a qualifying hospitalization, they may pay for a certain amount of your time in a nursing home for rehabilitation. So I think that might be where people get a little bit confused because they know that they've gone to the hospital, had a surgery or something, and then gone to a skilled nursing facility for a period of time. That is not the same thing as long-term care coverage. Long-term
Okay.
care would mean that, the nursing home is your home. It's where you live for the rest of your life.
That's true. That's why it's called long-term care. It makes sense.
Yeah. Yeah. So it's a little bit different. So if you've ever, I don't know, had a broken hip and you had surgery on your hip, and then you went to a nursing home for 6 or 8 weeks and did a lot of therapy, that's what would be a covered stay. But then you went home after that, right?
Mhm.
But if you stayed there long term, if you were going to stay there the rest of your life, Medicare would not cover the rest of that time, just the time where you were doing rehab.
Okay, that makes sense. Okay. Here's a question that I think, another little confusing question. So the person is asking, can you talk about the regulation change on the long-term care in California? They're saying is that there's talk about long-term care will be mandatory and become a deduction from everyone's paycheck. Have you heard of that?
I'm not familiar with that. I'm sorry. Yeah, you might call your benefits administrator at work and ask them, but I'm not familiar with that.
Okay, I hadn't heard from that one. I didn't know if you had heard from that one either.
No, but I'll look into it.
Okay. And let's see, one other question from the Medicare website. In most situations, Medicare won't pay for healthcare or supplies that you get outside of the United States. This is like that outside and inside the United States. So the question, I guess, is healthcare supplies. Will at least the Medicare pay for healthcare supplies like wheelchairs and et cetera?
Yeah, so there
Crutches.
is a part of Medicare to apply for things like durable medical equipment, so wheelchairs, other mobility aids, things like that. And then there is also, as part of hospice Medicare benefit, hospice separately will also provide whatever durable medical equipment is needed for that person who's on hospice.
Okay, so it does at least cover some of the supplies and equipment
Some of
that's
it.
needed. Yeah, okay.
So for example, it wouldn't cover if you are incontinent and you need supplies for that kind of hygiene. It's not going to
Right.
pay for that, doesn't pay for your gloves and things like that for your hygiene, but it would pay for your wheelchair, help you get your hospital bed if that's something that you needed. So, and then hospice separately pays for more things because hospice will pay much of the time for things like prescriptions specifically related to the condition that you're on hospice for. It'll pay for your incontinence supplies and things like that.
Okay, and then one last question. I know there's so many other questions in here, but one last question. She's asking, does Medicare Advantage pay for long-term care? The Medicare Advantage program.
So Medicare does not pay for long-term care.
Ah, so that Advantage program doesn't kick into it at all then, right?
No, Medicare Advantage is, it's a Medicare plan that has to do with your care team, right? Your doctors and what sort of hospitals and things like that and nursing homes that you would go to, but it does not pay for long-term care.
Okay, all right. Thank you. Back to you, Jacqueline. There's so many more questions, but we got to cut it off now. So back to you, Jacqueline.
Ooh, I know this could go on forever. A lot of
I
good questions
know.
in the
Ooh.
chat. Definitely. Again, thank you so much, Martin and Vanessa. It was very, very informative. So before we close out, though, we'd like to ask, what new thing have you learned today about long-term care and financial planning? Tell us what you learned from today's presentation. Put your answer in the chat. Joyce, see the answers in the chat? One person said they learned it was
still
very
looking for
expensive.
them. I'm still looking for them. Okay, so here they come. Okay.
Okay.
Let's okay, so so much of this, okay, the expense calculator, they like that one. I need Medi-Cal, not Medicaid. Thank you for the resources. They really like the graphs on senior living spectrum. Oh, that's a good one. That's a good one. So many questions have been unanswered, but so many questions have been answered. So a couple of people need to go back and look at the book again. I mean, the thing again. Let's see. Of course, this recording will be available. And, you know, it's very expensive. Yes, it's very, um, it's, and then one person says it's better to have Medicaid than Medicare. Of course, need to plan because it's really expensive. So they need to start planning early. So it's very expensive, cost of different care. So there's a lot of, there's a lot of people learn a lot of different things. So I'm glad everybody was listening and paying attention. To make sure you listen to this recording again. Back to you, Jacqueline.
Absolutely. Yeah, again, a wonderful, wonderful, informative presentation. We really appreciate it. So thank you for participating today. We hope you feel encouraged and have a better understanding of long-term care and financial planning. Maybe not a complete, but you have a better understanding and can a lot of resources. Please give us your feedback on today's program by completing our short survey. Click on the link that has been placed in the chat. And we invite you to check out some of our other upcoming AARP events. Join us for Tea and Coffee Tuesdays on Tuesday, December 12th at 9 a.m. Pacific for Calming Powers of Qigong for the holidays. And please come back in January for our quarterly Piggy Bank Essentials series with Martin and for 2024 featuring new and interesting financial topics. Maybe a part 2 on this. And again, a great big thank you to our guests, Martin Booker and Vanessa Souza. Our chat moderator, Joyce Howard, you had a lot of work to do today. Our volunteer production crew, Sarita Cardoza, our tech specialists, Vince King and Connie Moore, our AARP staff, and of